Hello everyone, welcome back to another session with me, Dr. Pranshu Mehta on Nextillo. So today we'll be discussing high yield images in ENT. So as you must be knowing already that these days majority of the questions in competitive exams, let it be any competitive exam, PLAB, USMLE, NEET or the next proposed exam which will be called the next NEXT. Every exam these days adopts a new method of asking questions, and that is asking pictorial questions. So in ENT also, there have been some pictorial questions. So today we'll discuss approximately 30 high yield images that are a sort of must for everyone to see. So let's start. This image might come as a question. So first and foremost thing will be, what is this image? First, we have to identify that this image is of what? You should be able to identify that this is a graph of BERA or ABR. So there can be a question which might directly ask, this represents what? This is BERA, brainstem evoked response audiometry, or ABR, right? Now in this, wave 1, wave 2, wave 3, wave 4, wave 5, they might ask time period from starting of stimulus to wave 1. What is this time period called? This is called absolute wave latency. Absolute wave latency. They might also ask, what do they mean by interwave latency? What is interwave latency? Interwave latency is nothing but time difference between two waves. Now, very important thing over here is, sometimes they may ask, what does wave number 1 represent, what does wave number 2 represent, or 3, and so on. So I write it here only for you. If you remember the auditory pathway, you will easily answer this, and you will be very happy to answer this. First, stimulus from cochlea goes through cranial nerve number 8. Distal part. So if the disease is in distal part, it is represented by wave number 1. So the stimulus in the distal part, right? Distal part of the cranial nerve number 8, that is vestibulocochlear nerve. This wave 1 is because of that. Then wave number 2 is because of proximal part, P, proximal part of vestibulocochlear nerve or cranial nerve number 8. Then from the nerve, now the impulse reaches, where does it reach? Cochlear nucleus. So wave number 3 is because of the stimulation of cochlear nucleus. Correct? Cochlear nucleus. Now wave number 4. Wave number 4 is because of superior olivary complex. Because of stimulation of superior olivary complex. Understood? Everything clear till now? Then wave number 5 is because of lateral lemniscus. So this is the major thing which they may ask, like which wave is because of what. So you'll remember distal part of the vestibulocochlear nerve, proximal part of the vestibulocochlear nerve, cochlear nucleus, superior olivary complex, lateral lemniscus. It's very easy. This is BERA. Let's move on to the other question. This image might be given, and this will be a very direct and very simple question. Identify the instrument or the object shown. This is laryngeal mask airway. Laryngeal mask airway. Okay, this is laryngeal mask airway. This covers the laryngeal inlet. This part will cover the laryngeal inlet, and then ventilation will be done through this side. Okay, moving to the next question. Now these graphs are very common and can come in any exam. So let's see. Let's first talk about this. So these are tympanograms. What is this? This is tympanogram. I write it tympanogram. But tympanogram of what? Tympanogram of impedance audiometry. When we do the impedance audiometry, this is what we get, tympanogram. If you get a graph which is labeled as A, this is seen in normal condition. You all must be knowing already. There, they will not mark it as A, they'll mark it as PQR or XYZ, and they'll ask you to identify it. Now this C occurs whenever there is negative pressure in the middle ear. Whenever there is negative pressure in the middle ear. The graph AD we see whenever there is ossicular discontinuity or hypermobility of the tympanic membrane. Correct? Then AS, we see AS type of graph whenever there is fixation of the ossicles. Now this fixation could be due to otosclerosis, tympanosclerosis, or any other reason. And the graph B, whenever there is no movement of the tympanic membrane. When it will be there? Due to very, very, very thickened tympanic membrane, or the other thing will be, like in what cases you will see this thickened tympanic membrane, or when there is no movement at all, whenever there will be fluid in the middle ear, that too thick viscous fluid in the middle ear. So you will get to see type B curve in tympanogram of impedance audiometry. So this is one of the very important images. Let's move forward. Now this, again I'll tell you, this image will look very simple and easy right now to you. But what happens is, when they'll give you this in exam, they'll just give you these two symbols and ask you, this is A, what does A represent, what does B represent? Then there will be an issue. So these are symbols which we use in pure tone audiometry, where PTA, pure tone audiometry. So whenever we do pure tone audiometry, these symbols are the symbols which we use for marking the patient's values on the audiogram. Now see, simple method I have told everyone in the sessions also. Always remember, red is always for the right side. So if you see red color anywhere, this is right. Close your eyes, nothing will be given. Only this will be given, only this one thing. If they ask this symbol stands for, you have seen red, it means you should know this is right side. So if you have 4 options where 2 options say right side air conduction, one says right side bone conduction, one says left side air conduction, one says left side bone conduction, at least you can eliminate the first 2 options. So you still have a chance of scoring. See, any red color is always for the right. Whenever there is blue color, it is always for the left. So this is always for the left. Now, upper 2 are for air conduction. Unmasked is this for right side, this for the left side. Masked is a triangle and a square. Correct? Then bone conduction, unmasked. For the right side, it will be red. We all know. Now, see, it's very easy to remember also. Right side, it is open. The bracket is open towards the right side. When it is masked, again, this bracket is also open towards the right side. For the left, first of all, it will be in blue. So it will be very easy for you to understand because it is in blue. It will be open on the left side. This also will be open on the left side. So this looks easy, but when it comes in the exam, it will definitely come. This is one of the questions which they definitely give because people get confused. Never get confused. Only focus on one basic principle. That principle is red is for right, blue is for left. If you cannot remember, just remember R. Red, R for right, R for red. So if you see anything in red, it is for the right side. Okay, moving ahead. This is an audiogram, pure tone audiogram. Now you have to identify which condition this depicts. Like this is describing which condition. Okay, so what I notice over here, first of all, we'll revise the question which we did just here. See, the question which we did over here. Let's just revise it. Let's see, this cross in blue color stands for what? Air conduction unmasked. Now see here. When I saw an audiogram, I already know that this is representing air conduction of left ear of a patient that also unmasked. Correct? So first use of that previous image we have done here only. That is the specific reason I have used this image immediately after the previous one. Now if you see, his hearing loss has a dip. his hearing has a dip at a specific frequency, that is 4K. Can you see that? Now this kind of hearing loss is seen in cases of noise-induced hearing loss. Noise-induced hearing loss. So the question can be framed in many ways. Question can be, this graph represents what? Person who can have hearing loss because of age, occupation, etc. So this you can go for occupation, because noise induced, people at the factories, people at their work can be exposed to loud noises, and because of noise, in the high exposure to high noise, this can happen. This hearing loss, which is noise induced, can occur, and this will show a dip at the frequency of 4K hertz. Now moving to the next question. Okay, again I have kept another pure tone audiograph. Okay, let's see over here. What is this? Again, first of all, you only tell me, what do you see? We see this as unmasked air conduction of left ear of the patient. Correct? Any doubt with this? No. Then this is bone conduction. This is the bone conduction. This is a bracket, square bracket, open towards left side of left side, but this is masked, right? If it was unmasked, it would have been like this. Clear? Any doubts? Very good. If you see, there is a dip at the frequency of 2000 hertz in the bone conduction. So at 2K hertz, there is a dip, or I can write 2000 hertz, there is a dip. Now this is very specific. A depression, a notch at 2K hertz frequency, 2000 hertz frequency. This notch we call as the Carhart's notch. This is because of the Carhart's phenomena, which we see in cases of autosclerosis. Okay, so this is a clear-cut case of autosclerosis. This is very simple. So whenever you see a graph like this, there is a dip. There's a dip at the frequency of 2000 hertz in bone conduction. So we have to be very sure about this. In bone conduction, we call it as the Carhart's notch. This is because of the Carhart's phenomena. Otherwise, autosclerosis is a conductive deafness disease, right? Patient should have conductive deafness. And if you see, deafness is also conductive only. Is air conduction is very poor. And bone conduction otherwise is good. But there is a dip in bone conduction only at one frequency. I should not make it with red. I'll make it with blue so that you remember the color coding also. This is what we call as the Carhart's notch. And this is seen in cases of autosclerosis. So shall we move to the next? I hope yes. Let's move to the next. Now this image. This is a very simple image. This will be a very direct question. What is the object seen, or what is the instrument seen in the question? So the answer to this will be, this is cochlear implant. Cochlear implant. You might get options as brainstem implant, as hearing aid, in-ear hearing aid, or cochlear implant. So the correct answer will be cochlear implant. Here you can see this is the electrode. You can see these dotted structures. This is what goes into the modulus of the cochlea. Now here also, if you see, right, this is the cochlear implant. So simple, straightforward question. What is seen in the picture? This is a cochlear implant. Now let's move ahead. This is one of the very frequently asked question and very easy to remember. What is this? What is this picture showing? First of all, you should know that this picture is showing a fracture. What fracture? Septal fracture. The septum of the nose is fractured. What is the name of this fracture? This fracture is called Chevalier fracture. This is caused because of a force or a punch from side. So if somebody hits like this from the side, the nose breaks in this manner and the fracture line runs vertically. There is one more fracture which might be asked, and fracture line in that fracture runs like this. What is the name of the other fracture? which I have not shown the image over here, but I'm just drawing it. Jarjave. Okay, so Jarjave and Chevalier. These two fractures are very common and very important. This one of the images might be there in your exams. So remember, here in the picture, whatever you see, this is Chevalier fracture. Clear? This is a septal fracture. Now let's move to the next image. What do you see? What image do you see? What is this? This will be a very straightforward question. What is this? And the answer will be expected like in a straightforward manner. They will not make a fancy question out of this. This is a celastic button. Celastic button. See, it looks like a button, right? A shirt button. Celastic button. But where do we use it? It is used in cases of septal perforation, to close the septal perforations. Whenever this is used to treat septal perforation. Whenever there is a, suppose this is the septum, there is a perforation over here, we can place this celastic button over here, and this will close the perforation or the communication between the two nasal cavities. So this is a celastic button used for septal perforation. This will be a straightforward question, so no need to worry about this. Okay, now this is a clinical picture. This is important because what happens is usually we are weak at the clinical pictures. Straightforward questions are very simple because most of you would have seen them many a times. But what happens when a clinical picture comes? First of all, try and identify what is this. But in this, it is very easy because I have already marked it. So this says vocal cord. So this is the vocal cord. This is left arytenoid. So this also will be the vocal cord. This will also will be the vocal cord. This is endotracheal tube going. So this must be the anterior side. That must be the posterior side. So now we see a structure, see grape-like structure coming from below. I can see it is coming from below, means through the trachea, and coming posteriorly. This is the posterior commissure, right? Coming here. This is showing, any guesses? Anybody? If somebody guessed, congratulations to him or her. This is respiratory papillomatosis. Now, if the age of the patient is given, this can be juvenile respiratory papillomatosis. If it's not given, this can be adult respiratory papillomatosis. They can ask, this is caused mostly by which virus? Which virus is involved? It's human papilloma virus. And this is a very, this is such a disease that recurs. It is recurring, like even if you treat the disease, it again occurs, it again reoccurs. Okay, so this is the respiratory papillomatosis. And this is one of the clinical pictures which you should try to identify. Whenever you have a doubt and you're not able to identify the exact clinical picture, try to locate the other structures around. If you can see the vocal cord, like at least you have an idea of the anatomical space where this picture is taken, or we are talking about what region of the human body. Okay, moving to the next picture. Now this picture is first of all, what is it? An X-ray? No, this is a picture, a cut of a CT scan. Which CT scan? CT scan of paranasal sinuses. Which section? A coronal section. A coronal section. Now, what is this coronal section showing? Actually, what is this cell? It will be very direct. Name this cell. This cell is agar nasal. Agar nasal. Now, how to identify this? See, whenever you see an air cell over here and the middle turbinate till now is not seen in the picture. Can you see the middle turbinate? No, this is the inferior turbinate, right? This is the septum, if you see. Now, on both sides, this and this is the inferior turbinate. Inferior turbinate. But there is no middle turbinate seen till now. So, when middle turbinate is not seen and there is pneumatization here, air cell is seen, this is called as the agar nasal. It's very easy to identify. If you see multiple air cells over here and there is presence of middle turbinate, then this is not the agarnase. This will be ethmoidal air cell. Now this will be a part of ethmoidal sinus. For now, this is agarnase. And what is agarnase? Agarnase is nothing but pneumatization of frontonasal process. I'll write it down. Pneumatization of frontonasal process. Frontonasal process of which bone? Of maxilla. So pneumatization of frontonasal process of maxilla by ethmoidal air cell. So ultimately it's ethmoidal air cell only, but it's not present in the ethmoid bone. Okay, ethmoidal air cell. So it is pneumatizing the frontonasal process of the maxilla. That is why it is placed such anteriorly. It's placed very anteriorly. Okay, this is agarnase. Okay, let's move to the next picture. This picture is, first of all, what is this? Can anybody identify this? This is a picture of human larynx. Human larynx. Now, if you look at this, posteriorly it has been cut open from both sides. So what are these structures? What is this structure P? Okay, I'll draw it for you. This is like this, the structure. This is epiglottis. Can everybody make out epiglottis? Yes. Then these will be your true vocal cords. This will be the anterior commissure area. Everybody clear? These are the false vocal cords. The false vocal cords. Now this area in between these two, what do you call it? The ventricle, where you have air. You can call it ventricle or saccule. Right? Clear, everyone? This is a picture of human larynx. So you can identify and mark the different. You can label this diagram on your own. Okay. Then coming to the next picture. What is this? What is seen? First of all, this is, what do you see right now? We are looking at the middle ear. We are looking at the middle ear. Now, if you look closely, there is a total perforation. Total perforation, can you see? Right? Now, what are the structures that you can see through it? Can you label structures? I have taught middle ear in all the sessions and I have focused so much on this, the anatomy. If you have seen the sessions, you should be able to answer this on your own. So, whatever we'll see first of all will be the structures which will be present in which part of the middle ear? Mesotympanum. So you must be knowing that. Mesotympanum. Now this will be the handle of Malleus. Right? Head will be somewhere here in the epitympanum. We are not talking about that. Then somewhere here will be the short process of incus, body of incus, and this structure which I have marked as P will be the long process of incus. Will be the long process of incus. Then this is the stapes, right? You can see. Now the structure which I have marked as M, you see this is pyramid, and this white structure from pyramid to the stapes is what? Tendon of the stapedius muscle. Tendon of stapedius muscle. Okay, now I'll just erase it so that you can see it again and you'll realize what I'm talking about. P is long process of the incus and M is the tendon of stapedius muscle. So this question can be given as a clinical picture, right? Okay, let's move ahead and come to some radiographs. Okay, very straightforward answer. This is foreign body. This is foreign body. Where? This is foreign body throat. Yes, foreign body throat, but where? In the hypopharynx. This is stuck in the hypopharynx, has not gone into the trachea. How can I be so sure? If you look at the coin, how is the opening of our larynx? It is anterior-posterior. Anterior-posterior. Vocal cords. So anything which is lying in the transverse plane will never cross it. Right? Understood? So this is lying in the transverse plane. And if you see from side, this cannot enter because here, if it was lying like this would have entered easily. So this is a foreign body. How to, even if you are asked this question in Viva, how to say this is a radiograph showing neck, right? Anterior posterior view and lateral view showing a circular, you can see this is circular, radio opaque foreign body, most probably coin. This coin is this foreign body is lodged in transverse plane and should be present at the level of hypopharynx. Clear? Now let's move forward. Okay, what does this image show? First of all, what part of the ear can you see in this? This is the tympanic membrane. This is the tympanic membrane. Now in this tympanic membrane, I can see this whitish structure. What is this? This is grome. Now the questions can be asked in multiple ways. You can be asked, name the disease in which this tube is inserted, this ventilation tube is inserted. So the disease is serous otitis media or otitis media with effusion or glue ear. Right? Any issues with this? This is also called the ventilatory tube or ventilation tube. Ventilation tube. You should be knowing that most popular of the gromes, one of the most popular gromes are of two types, Shaw and Shepherd. Shaw and Shepherd. Shaw and Shepherd. Okay. So this is image of grome, and this, if you see, has been placed in anterior inferior quadrant of the tympanic membrane. Anterior inferior quadrant. Clear? Let's go to the other picture. Okay, now what is this? This is a chest radiograph showing steeple sign. Which sign? Steeple sign. You can see the narrowing over here. Can you see it? Now what is steeple? It's an English word, very simple word. If you see any temple or a church, when you see how it goes up, it becomes like this. Specifically, churches used to have this. So this part, this is what we call a steeple. So here the narrowing, and what is the condition in which we see steeple sign? So okay, you might be able to guess steeple sign, but they'll ask you what is the condition associated with it. That'll be croup, but that also will be a very straightforward question. So they'll not give you a question like this. They'll frame it in a way where they'll give you the clinical scenario. Like a child of dash and dash age presented with barking husky cough, difficulty to breathe. Then his chest x-ray was taken and this is what is shown. Or they might give the other name of group, which is laryngotracheobronchitis. I'll write it, laryngotracheobronchitis. Right? Simple, laryngotracheobronchitis. Laryngotracheobronchitis. Because this is involving all three. There's inflammation of the larynx, then the trachea, and going till the bronchus. So laryngotracheobronchitis. Now this is usually caused by paramyxovirus. So that can also be a part of the question. Paramyxovirus. Okay. So this is also one of the images which is given frequently in the exams. So that's all for today. See you for the next session. Stay healthy.